Imagine this. Your heart races, your thoughts spiral out of control, and every sound feels like a thunderclap in your mind. You're trapped in a storm no one else can see. This is acute agitation, often misunderstood crisis that can strike anyone, anywhere, at any time. It's not just feeling stressed or annoyed. It's deeper, darker, and far more overwhelming. And why does it matter? Uncover the truth behind this invisible battle. Acute agitation isn't just a bad day or a moment of frustration. It's an intense state of emotional and physical unrest. Picture this. Your body feels like it's on high alert. Your mind races with thoughts you can't control. You might feel irritable, restless, or even aggressive. It's like being caught in a whirlwind of emotions you can't escape. But here's the thing. Acute agitation isn't just a mental health issue. It can stem from medical conditions, substance use, or even environmental triggers. For some, it's a symptom of anxiety or depression. For others, it's a reaction to pain, medication, or overwhelming stress. Understanding it is the first step to taming the storm, because when you know what you're dealing with, you can start to take control. Let's take a closer look at what's really going on inside your brain when acute agitation hits. It all starts with your amygdala, the part of your brain that acts like an alarm system. When something triggers you, the amygdala sounds the alarm, flooding your body with stress hormones like cortisol and adrenaline. At the same time, your prefrontal cortex, the part of your brain responsible for rational thinking, gets overwhelmed. It's like trying to have a calm conversation while someone is shouting in your ear. This imbalance creates a perfect storm, leaving you feeling out of control. But why does this happen? Sometimes, it's your brain's way of protecting you from perceived threats. Other times, it's a sign that something deeper is going on. Understanding this process is the first step toward regaining control. For some people, stress is the main trigger. It could be work pressure, relationship problems, or financial worries. For others, it's trauma, sleep deprivation, or even certain medications. Sometimes it's a symptom of underlying conditions like anxiety, bipolar disorder, or dementia. Even your environment can play a role. Loud noises, crowded spaces, or feeling trapped can all make agitation worse. The key is identifying what's fueling your fire, because once you know the triggers, you can start to take steps to manage them. Acute agitation doesn't just affect the person experiencing it. It ripples out, touching every part of their life. Imagine being unable to communicate how you're feeling, lashing out at loved ones, or feeling trapped in your own mind. It's isolating, exhausting, and often misunderstood. For those around you, it can be just as hard. They might not know how to help or what to say. Relationships can strain, work can suffer, and everyday tasks can feel impossible. The emotional toll is heavy, and the guilt that follows can make things even worse. But here's the thing. Understanding this ripple effect is crucial. It's not just about managing the agitation itself. It's about healing the connections it damages and rebuilding a sense of calm and control. So, how do you calm the storm? Managing acute agitation isn't about suppressing your emotions. It's about finding balance. In the moment, techniques like deep breathing, grounding exercises, or mindfulness can help. Focus on your breath, count to 10, or name 5 things you can see around you. These small steps can help you regain control when everything feels chaotic. For the long term, it's about addressing the root causes. Therapy can help you understand and manage your triggers. Medication, if needed, can provide relief. Lifestyle changes, like better sleep, regular exercise, and a healthy diet, can also make a big difference. If you or someone you know is struggling with acute agitation, it's okay to ask for help. Seeking support isn't a sign of weakness, it's a step toward strength. Sometimes the storm feels too big to handle alone, and that's completely normal. Talking to a therapist or counselor can provide tools and strategies to manage your emotions. Consulting a doctor can help rule out underlying medical conditions or explore medication options. Even reaching out to a trusted friend or family member can make a world of difference. Acute agitation may feel like an endless storm, but every storm eventually passes. By understanding it, addressing its triggers, and seeking help when needed, we can find calm in the chaos. It's not about eliminating the storm entirely, it's about learning to navigate it.